Now this is the second part of our presentation on the LEGO network, which was a proposal to structure the diagnosis for children in the state of Paraíba in northeast Brazil, based on knowledge transfer and leadership empowerment, grouping, and optimization of services. Now, in this part, we'll briefly discuss the methods. To start the LEGO network, we conducted an initial evaluation, database analysis, clinical surveys, and from there, we defined that these priorities that we had were to define and connect the sites, train the teams, screen neonates, and establish surgical facilities. When we looked at all the maternity units in Paraíba, we realized that 12 of them covered for nearly 70% of all public health births in the state, and that was the reason why we decided to start the work with those two maternities. When we looked in the map, we realized that they actually were well distributed from the coastline, from the capital city of João Pessoa in the coastline, well into the countryside, to the city of Cajazeiras, which is far opposite to the capital. We then proceeded to divide those 12 maternities into three groups of 4 maternities each. And you see here in the very dry lands, we had one maternity, which is the key maternity for this group. These other 3 were joined. And then the second group is more in the center part of the state, with the key maternity being the one in Campina Grande, and the third, where the maternities are actually in the coastline, 3 of them in the capital city and 1 close by. And after those 2 maternities, 1 pediatric hospital was also joined to become the pediatric cardiology place, referral center. We then proceeded to connect all the 13 centers amongst themselves and with the Heart Circle in Pernambuco. Developed a dedicated website to host all information regarding the Heart Circle. In this website, you have a number of areas, most of them which are free, and one which refers to patient database, which is accessed only with login and passwords. And once you're inside there, you have all data for all patients, the ones that are inpatients, the outpatients, the echoes, the images, and a non-call, 24-hour on-call evaluation and data collected for them, any extra piece of data that may occur during the day, and maps showing us the full operation in the state of Paraíba. Then we proceeded to develop protocols, and there were 3 main technical protocols, one to help use the website, the other one to help use the WebEx teleconference area, which was acquired for the project, and one to train people to acquire and transmit images, particularly echo images. From the screening programs, we had 3 protocols again, one for physical examination, reinforcing peripheral pulse palpation and auscultation, one for the pulse oximeter testing, which was primarily directed to nurses and followed the guidelines published at the time in 2011. There were no Brazilian guidelines at the time, so this followed international guidelines. And one which was the screening echoes, which was an echo to be performed by a neonatologist and the cardiologist supervision, and included 3 views, the 4 chambers and the outflows of the 2 ventricles. Finally, there were specific protocols for the care of these children, and the initial ones focused in the pre, intra, and post-operative periods. So the network structure was arranged this way. There is a level 1, level 2, and level 3 units. The level 1 are those maternities in which pulse oximeter and physical examination, focused clinical examination and pulse oximeter testing is done. All those maternities receive tablets. On the secondary, the level 2 sites, there was added a portable echo machine so they could do the screening echoes, And for the level 3, which is the pediatric hospital, the cardiology and cardiac surgical facilities were set up. The flows of the network are like this. The surgeons agreed to travel once a week to João Pessoa to do surgery, and in Recife, a 24-hour online on-call team supervised all the remaining activities via telemedicine that included virtual ward rounds, screening echoes and management orientation, hospital transferals, virtual outpatient clinics, and post-op interaction between the groups. This is the network flow. All children undergo a focused clinical examination and a pulse oximeter test. Those who are normal follow their routine neonatal management. Those who are abnormal are referred to a screening echo. This normal screening echoes, again, the child follows the normal routine pathway, and those who are abnormal or inconclusive then reach the cardiologist. So by doing this, we share the load of work, and we get more children to be evaluated by the nurses and the neonatologists. And as we have very few cardiologists, there were only 2 full-time cardiologists able to join the network in Paraíba when we started. So we tried to get only children with heart problems to reach the cardiology stage of the flow. So this is the end of our methodology. And then in part 3 of this presentation, we'll briefly discuss the results.